Riociguat is a novel drug that is a stimulator of soluble guanylate cyclase. Clinical trials have looked at Riociguat as a new approach to treat two forms of pulmonary hypertension, chronic thromboembolic pulmonary hypertension and pulmonary arterial hypertension. Riociguat constitutes the first drug of a novel class of SGC stimulators. Contraindications: Riociguat can cause fetal harm and is therefore contraindicated in pregnant women. Adverse effects: serious adverse effects and clinical trials included bleeding, hypertension, headache, and gastrointestinal disorders also occurred. Interactions: nitrates and phosphodiesterase inhibitors increase the hypertensive effect of Riociguat. Combining such drugs is therefore contraindicated. Riociguat levels in the blood are reduced by tobacco smoking and strong inducers of the liver enzyme CYP3A4, and increased by strong cytochrome inhibitors. Chemistry and mechanism of action: in healthy individuals, nitric oxide acts as a signaling molecule on vascular smooth muscle cells to induce vasodilation. NO binds to soluble guanylate cyclase and mediates the synthesis of the secondary messenger cyclic guanosine monophosphate. SGC forms heterodimers consisting of a larger alpha subunit and a smaller heme-binding beta subunit. The synthesized cGMP acts as a secondary messenger and activates cGMP-dependent protein kinase to regulate cytosolic calcium ion concentration. This changes the actiniuromyosin contractility, which results in vasodilation. NO is produced by the enzyme endothelial nitric oxide synthetase NO synthase. In patients with pulmonary arterial hypertension, eNOS levels are reduced. This results in overall lower levels of endothelial cell-derived NO and reduced vasodilation of smooth muscle cells. NO also reduces pulmonary smooth muscle cell growth and antagonizes platelet inhibition, factors which play a key role in the pathogenesis of PAH. In contrast to NO and heme-independent SGC activators like Riociguat, the SGC stimulator Riociguat directly stimulates SGC activity independent of NO and also acts in synergy with NO to produce anti-aggregatory, anti-proliferative, and vasodilatory effects. Pharmacology: Riociguat at concentration between 0.1 and 100 mol stimulates in a dose-dependent manner SGC activity up to 73-fold. In addition, it acts synergistically with diethylamine NO, the donor of NO, to increase SGC activity in vitro up to 112-fold. A phase I study showed that Riociguat is rapidly absorbed, and maximum plasma concentration is reached between 0.5 to 1.5 H. The mean elimination half-life appears to be 5 to 10 hours. Riociguat plasma concentrations have been also shown to be quite variable between patients, indicating that for clinical use it is probably necessary to titrate the drug specifically for each individual. History =discovery The first nitric oxide independent, heme-dependent SGC stimulator YC1, a synthetic benzylidazole derivative, was described in 1978. The characterization 20 years later demonstrated that as well as increasing SGC activity, YC1 acted in synergy with NO to stimulate SGC. However, YC1 was a relatively weak vasodilator and had side effects. Therefore, the search began for novel indazole compounds that were more potent and more specific SGC stimulators. The result was the identification of Bay41-2272 and Bay41-8543. Both compounds were tested in various preclinical studies on different animal models and appeared to improve systemic arterial oxygenation. To improve the pharmacologic and pharmacokinetic profile, an additional 1,000 compounds were screened, leading to the discovery of Riociguat. Riociguat was tested in mouse and rat disease models, where it effectively reduced pulmonary hypertension and reversed the associated right heart hypertrophy and ventricular remodeling. Several clinical trials have been undertaken to investigate and evaluate diverse aspects of Riociguat, and some of them are still ongoing. Phase I clinical trials. One of the first studies was designed to test the safety profile, pharmacokinetics and pharmacodynamics of single oral doses of Riociguat. 58 healthy male subjects were given Riociguat orally in a randomized, placebo-controlled trial. Doses of Riociguat were increased stepwise, and Riociguat was well tolerated up to 2.5 mg. Phase 2 clinical trials A proof of concept study, reported by the University of Jiangyin Lung Center, was the first small study to investigate safety, tolerability, pharmacokinetics and efficacy parameters. The drug was well tolerated and superior to NO in efficacy and duration. An open-label, non-controlled Phase 2 trial of Riociguat in 75 adult patients functional class 2 or 3, evaluated the safety and tolerability, and the effects on hemodynamics, exercise capacity and functional class. Riociguat was given 3 times daily for 12 weeks. Doses were titrated at 2-week intervals from 1.0 mg 3 times daily to a maximum of 2.5 mg 3 times daily. Riociguat had a favorable safety profile, and also significantly improved exercise capacity and hemodynamic parameters such as pulmonary vascular resistance, cardiac output and pulmonary arterial pressure compared to baseline values. In addition, a Phase 2 study of Riociguat is underway in patients suffering from other forms of PH such as associated with interstitial lung disease. First results from this study are expected in 2011. Phase 3 clinical trials The Phase 3 trials on Riociguat are multi-center studies. The study program includes large randomized, double-blind, placebo-controlled pivotal trial phase, and open-label extensions of these studies. Details of these studies are reported on clinicaltrials.gov, a register of studies maintained by the National Institutes of Health. CHEST, the Chronic Thromboembolic Pulmonary Hypertension (SGC) Stimulator trial is a randomized, placebo-controlled trial that is aimed to analyze the efficacy and safety of Riociguat in CTE-PH patients. After a 16-week Riociguat treatment, the PATN-to unregistered trademark S exercise capacity will be evaluated by measuring the change in the 6-minute walk test. Patients having completed CHEST-1 will be invited to enter the extension trial, CHEST-2. The trial is ongoing as of December 2009. Patent, the Pulmonary Arterial Hypertension (SGC) Stimulator trial is a randomized, placebo-controlled trial that investigates the efficacy and safety of Riociguat in PAH patients. After a 12-week treatment, the PATN-to unregistered trademark S exercise capacity will be evaluated by measuring the change in the 6-MWT. Patients having completed Patent-1 will be invited to enter the extension trial, Patent-2. The trial is ongoing as of December 2009. Other studies Effect of Riociguat on bone metabolism. This randomized, double-blind, placebo-controlled Phase I study investigates the effect of Riociguat, administered as 2.5 mg immediate-release tablets twice daily over 14 days, on the bone metabolism. Final data collection is expected in December 2009. Interaction study with sildenafil. This study investigates safety, tolerability, pharmacokinetics and the impact on pulmonary and systemic hemodynamics of single doses of 0.5 and 1 mg of Riociguat in patients with PAH and stable treatment of sildenafil in a non-randomized uncontrolled trial. The study has been completed in August 2009, results are outstanding as of December 2009. See also, Riociguat, a SGC activator. PDE5 inhibitors act downstream in the nitric oxide signaling pathway, reducing cyclic GMP degradation. Endothelin receptor antagonist, another class of drugs used in PAH. ALll, bibliography on HOP. References